It's one of the most painful conditions known to humans, cluster headache. A pain so severe that female sufferers say it's worse than childbirth. The attacks can recur again and again over many months. Now the charity OUCH, which stands for Organisation for the Understanding of Cluster Headache, is fighting to raise awareness of this incurable condition and to provide support for sufferers and their families. Cluster headache manifests with strikingly characteristic features. Each attack can last up to 3 hours if left untreated. The pain is so intense that most sufferers cannot sit still during an attack. Some sufferers have been known to commit suicide because they can no longer bear the pain. Around 250,000 people in the UK suffer from cluster headache. That's about 4 for every 1,000 of the population. It's estimated that cluster headache is 10 times more painful than migraine.
Cluster headache is a recurrent form of headache with terrible disabling attacks of pain, usually on one side of the head, that are associated with particular features like eye watering and redness, and usually with agitation in their behaviour. They come and they go, they blight a person when they're there, and they disappear.
Val Hobbs has up to 4 of these cluster headache attacks a day.
I'm sorry, I'm going to have to do an injection.
The headache's cause is unknown, and so far there are only 2 treatments that have proved to bring some relief to sufferers. A self-administered injection of a drug called Imigran. This treatment is relatively expensive, and so GPs can be unwilling to prescribe it. Breathing oxygen at a high rate for 15 to 20 minutes has also been shown to provide effective pain relief.
It just totally takes you over. There is nothing, there is just the pain. And I can understand why, sadly, some sufferers have taken their own lives, because you just want to get rid of the pain.
Unfortunately, cluster headache is a lifelong disorder, and the charity OUCH was set up to support the ongoing needs of sufferers. Their mission is clear.
To get GPs and neurologists to understand the agony that we go through and the fact that we do not get the medication that we are promised by the National Institute of Clinical Excellence.
OUCH, the Organisation for Understanding Cluster Headache, is just the most wonderful example of an expert patient group working within and outside the NHS to improve our understanding of the disease, to help promote the disease to doctors and within the NHS and to patients, and to provide support for patients. They're crucial, they're unique, and they're expert.